From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about forensic nursing and special treatment provided to help sexual assault survivors. Our guest today is Elizabeth Kovach, a board-certified sexual assault nurse examiner, or SANE nurse, who coordinates Sarasota Memorial's forensic program and the team of more than 40 specialized forensic nurses who've been caring for patients throughout Sarasota County and beyond since 2015. Thank you so much for joining us today.
Thank you for having me.
What challenges are most commonly faced when survivors of sexual assault are brought to the hospital?
Really, I think the biggest challenge is just coming to the door, to having the courage to show up and ask for help. And that's what we're here for, is to help people come through this very challenging time.
What is a SANE nurse, and how does that differentiate from another nurse that someone might encounter in an ER?
So a SANE nurse is a sexual assault nurse examiner. We're a type of forensic nursing that has specialized training to handle patients who've been through some sort of trauma like sexual assault, domestic violence, human trafficking. And we have a trauma-informed approach that starts from the moment we come into the room and through evidence collection, and we have specialized training to help identify and document injuries. And then all the way to the courtroom, we are expert witnesses as well. So if it were to ever get to that point, then our team is able to stand up in court as well to testify to our findings and the things that happened during that exam.
What special training that you mentioned do SANE nurses receive to help deal with these challenges and the others that this patient population faces?
It's pretty extensive, actually. Our team starts with a core 48 hours of training, and that includes our community partners. We have victim advocates from SPARC, law enforcement agencies. We have someone from the state attorney's office come. We now have a defense attorney that comes and speaks to the class. We work with a human trafficking agency that comes and does a human trafficking discussion with or training with the team. And it just really tries to hit all the different areas of the specialized training, and with many different guest speakers to try to make it a very comprehensive training. Then we have hands-on as well and forensic photography. It just covers a lot of different things.
These patients can often be very hesitant, as you mentioned. The first challenge is just even seeking help or coming to the door of the ER. So how do you help guide them through what can be an incredibly invasive process or feel invasive?
Sure. The first thing that we can do is help give them their power back. So everything that's happened to them, they've had power taken away from them and not been able to have a say in what's happening to them. So our first job is to try to make them feel secure and to approach them in a manner that's respectful and providing them options. So education is a lot of what we do. We want to provide them with all the education on options that they have, what they can have done when they are in our emergency room. And that can range from, I'm choosing just to have a medical exam to know I'm okay, to receive medications, all the way up to speaking to law enforcement and having evidence collection completed, or even, I'm not sure what I'd like to have done, so can I have evidence collected now, anonymously, and then later speak to law enforcement if I ever choose that that's what I'd like to do.
How do SANE nurses help coordinate with other healthcare providers and staff who may interact with these patients but don't have that same training that SANE nurses do?
We start with basic education for the whole department. It's very collaborative, so our physicians work with our SANE nurses as well. Our nurses actually do the entire exam, including the speculum exam and the evidence collection. And our providers are there for anything that we may need to help the patient, especially if we identify additional medical needs that need to be addressed. That's when our physician will step in and provide extra support. And then we have the rest of our staff who's there to support the team and the patient as well.
What has Sarasota Memorial done to ensure that these nurses are always available when needed? And why has this program been so successful at SMH?
So it's been an evolution over time. We started with just having ER nurses trained, starting with a 40-hour class, which we've expanded on that. We now have a hybrid team where we not only have ER nurses trained, but we have nurses throughout the entire hospital system who comprise our on-call team. So whether it's the nurse coming directly from the ER or the nurse coming in on call. They work together in order to provide these services for the patient. And that can be unique to the area as well.
And that's that on-call service is available 24/7 to be there for them.
One way or another, we're going to have a SANE nurse take care of that patient that's in that position, and that's something that is very important to us as a system. As a community hospital, we feel it's our responsibility to step up and provide care for this very specialized population that really needs this extra education on making sure that we're meeting the needs of the patient so that they can have the best chance of starting their path to survival and healing.
And as the health system has expanded, the availability of these nurses has expanded as well, in the sense that it's not just the Sarasota campus where you could see a SANE nurse, correct?
That's correct. We have SANE nurses at all 3 locations, so Sarasota, Northport, and Venice, and our on-call team responds to all 3 locations. So as the health system expands, our coverage will expand as well.
Is there any other way that the program has changed or expanded since 2015?
Absolutely. We started with just a handful of us, no on-call team. It was all ER, and we didn't even have a camera when we started. So now we have, expert equipment at all of 3 locations where we can take those photographs that can be so important. And again, that's only if the patient chooses to have that done. They're not required to do anything. One of our jobs is to give them their options and help them make a decision that's best for them.
And while this program is available, obviously, in Sarasota County, because this is a public hospital in Sarasota County, you help patients from all over the region, correct?
We do. We have patients sent to us from Charlotte County, DeSoto, Manatee County. There's not very many SANE trained nurses in the state, or really at all to begin with. So to have the availability of SANE trained nurses to care for these patients has been a pretty important resource for the area. So law enforcement and other resources are aware that we have the trained nurses. So they will recommend to the patient to go somewhere where a SANE trained nurse can take care of them. And in our area, that would be Sarasota Memorial.
So do you think awareness of the SANE program has grown in the area?
I do. We're seeing more patients than we used to. So when we first started the team, we were seeing on average 5 or 6 patients a month. We currently see closer to 18 to 20 patients a month, and not all of those patients choose to have a full exam, but our team is still there to offer resources. So the education has grown not only within our community, but within our hospital system as well. We have our own consult order that anyone in the hospital can enter, so that consults our team to come evaluate a patient where there's concern for sexual assault, abuse, neglect, or things like that. So we're able to go anywhere within the hospital to speak to a patient to see if we can provide some services to them.
And the collaboration isn't just within the hospital. Can you discuss some of the collaboration SMH is doing to ensure these nurses are available to all survivors who need them, no matter where they're from, and some of the agencies you work with to collaborate with?
Sure. We don't turn anyone away. So anyone who walks through our door has the full access to our team and the resources that are available. We work with all law enforcement agencies. We work with victim advocates such as Spark, and in other counties there's Hope and CARE, different victim advocates. We also work with the state attorney's office, who are, if it gets to prosecution, so we provide expert testimony or even consultation. If there's a question where they're not sure what something means, we're happy to provide that expert testimony or just information for them to know how to proceed. We also work with other counties, so there may be instance where they don't have a SANE nurse available in the other county, but they know that we will have someone available. So they'll send the patient to one of our campuses so that we can meet the patient and then meet the needs of that patient as well.
And it's not just other agencies or within the health system that this program at Sarasota Memorial has been noticed, but in the 5th magnet designation that Sarasota Memorial just received, this was recognized as an exemplar program. Can you talk about what that is and why that's so important?
Yes, being a magnet facility is something that Sarasota Memorial is very proud of, and it's very difficult to get that 5th designation. And we were able to be a part of that process. Our team was interviewed by the magnet team, And we were able to showcase the different things that our team has been able to bring to the community. Being chosen as one of the top exemplars for the magnet designation was something that we're very proud of. And what that means is that we have a nurse-driven program. So nurses identified that there was a lack of services and resources in our community, and we put the program together, and we have brought it to the point where we are a resource in the community for survivors who can come and receive very evidence-based trauma-informed care. So that is part of being the Magnet program, and being one of the Magnet exemplars means that the Magnet evaluators decided that what we're doing, what our nurses are doing for survivors in our community is nursing excellence and something for other Magnet hospitals to be able to provide as well.
We've talked a lot about the SANE program today. Is there anything that you want to add about SANE nurses or what SMH is doing with SANE nurses that you think is important?
Yeah, well, first I think we just want people to know that we're here as a resource. We don't force anyone to do anything they don't want to do. We're simply here to provide options and to help that patient become empowered in being able to choose what they'd like to have done. So that's an important thing for us to be able to do for survivors in that position. And it's very unique to have the amount of support that we do from our hospital system all the way to the top, especially through the Magnet designation. But there are many programs that, first of all, don't even exist because the hospital doesn't back what they do. But Sarasota Memorial has really recognized the benefit to having properly trained nurses at the bedside to provide that trauma-informed care to survivors of sexual assault.
It's very important. Well, Elizabeth, thank you so much for answering all these questions today and being with us. As always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.